Myself, Dr. Shubham Jain. I am consultant gastroenterologist. I practice as an assistant professor at Department of Gastroenterology in IR Hospital, Mumbai, and other South Mumbai hospitals. So today we have gathered to speak about a particular question which so many patients of mine ask me, that if we are feeling well, do we need to follow up with you? So IBD has two diseases which we all know: ulcerative colitis and Crohn's disease. And as a perspective of understanding the disease, this is important that even when you are feeling well, because your symptoms have gone down, but then also you can have endoscopically, it means that in the intestine still there might be some ulcers or inflammation, or even not endoscopically, histologically, it means when we take the biopsies from your intestine, it can show in the microscope that is still the disease is active. So it is always better that you have to follow up with the concerned gastroenterologist or your doctor even when you are feeling well, because if you don't do this, then and if you stop medication or follow up, then in one day you will come up with a relapse or recurrence of the disease, and then it becomes difficult as a physician also to manage those things, because the disease progresses fast. So I think it is better to err on a regular visit to your doctor so that we can avoid the future complication or worsening of the disease. Second, what we can speak about is what are the challenges in older population when they have the inflammatory bowel disease. Because of the old age, as we know that many of the geriatric population have other diseases also, like diabetes, blood pressure, bone diseases, especially in female who have attained menopause, they have osteoporosis and whatnot, maybe heart diseases or any kidney diseases. So when you have a disease in background over and above to the inflammatory bowel disease, it is difficult to manage such cases. And as a geriatric population, they have polypharmacy for all these diseases which is going on. So there are chances of interactions, drug to drug interaction, when you are taking multiple drugs. Second, because of the older age, because of the frailty or because of the decrease in the energy level as compared to a younger guy, you need to understand when these diseases become active, like bleeding per rectum or abdominal pain, it is more difficult for you to manage these symptoms. So therefore a regular follow-up and concerned about that which medication to be taken with which medication, drug interaction clarity should be there. Secondly, all my IBD patients should take vitamin D supplements and calcium supplement when they are being given steroid for managing the relapse of the inflammatory bowel disease, because steroids are known to cause bone depletion and therefore it can lead to fractures and all those things. So I think you need to take care of your nutrition, you need to take care of drugs on proper time with no drug to drug interaction as possible, you need to take calcium and vitamin D supplements, and over and above you need to do regular exercise, because it is been shown that when you have sarcopenia or decrease in the level of the muscle mass, there is increase in the activity of the inflammatory bowel disease, which is seen more commonly in older population as compared to younger. So you need to have a regular exercise, whatever you can do at your level. I think that is very much important. Thank you.